Lassa fever is a hemorrhagic fever caused by the Lassa virus. The virus spread by rats is found predominantly in West and East Africa. David Esile, a doctor and Lassa fever survivor, says he caught the illness working at his infectious disease unit, even though he wore his personal protective equipment.
I was the first case of a health worker working inside the infectious control ward, having to get Lassa fever. And immediately, I was stripped off my PPE and my uniform, and I was given that of a patient. The psychological trauma was there. The stigmatization in quotes was also there. The family fear was there. And it was a whole lot, which I had to really cope with.
The Nigerian Center for Disease Control, NCDC, which manages disease outbreaks, says that in the first 12 weeks of 2020, it recorded more than 900 confirmed cases of Lassa fever. 176 people died across 27 states. Health experts say early detection is key to reducing Lassa fever casualties.
Most of the patients, when they present early, the mortality is very small. But when they present late, the mortality is high. The mortality here used to be up to like 40 to 60%. But now with, availability of testing kits, now we could easily be able to identify those patients early. The mortality has dropped to around 20%.
According to the NCDC, 34 health workers have been infected by Lassa fever this year through direct contact with body fluid of patients. Health workers say the lack of protective clothing is a major challenge.
Patients come in already bleeding, which they have gone down with the disease but did not come to a health facility on time. So in the eagerness of the nurses to take care of these patients, those kind of viruses can then attack their own immune system.
Nigeria is also battling an outbreak of COVID-19, with 3 states already on lockdown to curb the spread of the virus. Medical experts say adequate attention should also be given to the ongoing Lassa fever outbreak.
No awareness, people talking about coronavirus more than Lassa fever. But the truth is that Lassa fever is killing people at the moment.
The Nigerian Center for Disease Control says 100,000 to 300,000 cases of Lassa fever and about 5,000 deaths are recorded across West Africa each year. There is currently no vaccine yet to prevent the spread of the Lassa virus. However, Nigerian authorities say research is underway to find a lasting solution to the annual scourge. Ifiok Ettang for VOA News, Jos, Nigeria.